Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
We're revisiting one of the friends of the program, with the Patients Program. He's not new to the Patients Program. He's a physician, and he literally just came from surgery. Like, I can honestly say that. Like, he came from surgery to have a conversation about a project that's near and dear to him and his team, and I'm excited about having a conversation. Joining him is Donna and Miss Margaret. They have participated in his project, and we're talking today about getting their perspective from the patient, getting the perspective from the caregiver on how we all can improve patient engagement when it comes to research. Ms. Margaret, it's a pleasure to meeting you. I know we talked a little bit before we started recording, but I just want to thank you again for joining us, Donna, as well. So welcome to The Bridge, Ms. Margaret and Donna. How are you both doing today?
Fine. We're doing well. Thank you for having us.
You're more than welcome, more than welcome. So before we get into it, I'm going to introduce Dr. Slobogean and have him come in and chat a little bit about why we're here and get into the specifics of the particular project that we're talking about today. Then we're going to have a couple questions with Ms. Margaret and Donna, and hopefully you guys finish. When we're all done, you'll be able to hear how Dr. Slobogean and his team works with a patient and a caregiver, all in an effort to not only help them in their challenges and issues that they're dealing with when it comes to this particular project, but also some procedures and some protocols afterwards, because we're all about making sure that not only do we take care of what's the matter at hand, but we're finding ways, always trying to still be innovative and learn as we go along. So Dr. Slobogean, if you don't mind joining us, jumping in and tell us a little bit about why we're here today.
Sure. Thanks, Rodney. And of course, thanks, Miss Margaret and Donna, for joining us and for being patient partners with us on these studies and on these initiatives. So I'm an orthopedic surgeon, and I'm one of many surgeons that's interested in trying to improve the care of patients that have hip fractures. And currently, myself and my colleagues all across the country, we're trying to answer two specific questions. The first one is something called hip attack 2. And just like a heart attack, hip attack, it implies that there's some urgency to fixing or treating patients with a hip fracture. And so there's some patients that have a hip fracture and they're also having a heart injury, almost like a mild heart attack at the same time while they're waiting to have their surgery. And that fundamentally, there's a question there. Should we try and do your surgery as fast as possible, get you to the operating room as fast as possible, because that may reduce some of the stress on your heart, and that'll be helpful for your heart and your ability to recover sooner? Or should we do kind of what we always do, which is keep an eye on you, make sure that you're getting better, make sure it's, safe, whatever that means, before we take you to the operating room? And so fundamentally, how fast we take you to the operating room is the question behind hip attack 2. The other study that we're doing is something called faster hip. And although this may sound like it's another timing study, but this one's actually probably really important to Miss Margaret. This is where when you have a certain type of hip fracture, we can either try and fix the fracture and put some screws across the fracture, or we can just say, you know what, let's replace it instead. Then we don't have to worry about the healing of the bone. You can start walking on it immediately. And so that's also a fundamental question. And both of these studies, hip attack 2 and faster hip, really mirror questions that doctors every day have to ask their patients or have to implement for their patients. And so we want to know if one of these treatment strategies may be a little bit better. And so to do that, we partner with patients like Miss Margaret and Donna and caregivers and families and all across the country to try and come together to answer these questions. And really, Rodney, what this comes down to is asking our patients to participate and help us answer.
Thank you, Dr. Slobogean. I appreciate that. And that is exactly what it comes down to, right? We love having conversations about the procedures. We love having conversations about protocol, but we also like to give experiences, the lived experiences of the patient and the caregiver that's involved in this process. And today, that's exactly what we're going to do. We're going to have a conversation with Miss Donna and Miss Margaret. They're going to talk about how they came to actually participate in this project. They're going to talk about their experiences. And then in the end, when we finish, we're going to figure out if the things that Dr. Slobogean, their team worked on with the caregiver, with the patient, is in line with how they can move forward in addressing some of these issues when it comes to hip attack and hip attack 2. So, Ms. Margaret and Donna, I'm going to pitch this question to both of you first, and then we can continue on with the questions I have in line. What motivated you to participate in this medical research study, Miss Margaret? I know you have your daughter there, Donna, helping you along the way, but talk to us a little bit about what motivated you to participate in this project.
Well, I wanted to let the doctors and the nurses to know that they need to talk with the patient and the families to help them understand what their opinions are as patients.
Yes, ma'am. That is very important, talking to the patient and the caregivers, because again, you're sitting there right there with your daughter, Donna, helping you out. Donna, can you talk to us a little bit about, what motivated you as the caregiver to participate in this project?
So I, as a nurse, get to see the side where the families are brought in and they've made the decisions and the stress that the patients are under. And then when it was my mom, it was a whole different ballgame. Like, here we are making these decisions. When my mother was injured, of course, it was a holiday weekend. It was really busy in the emergency room. And I just wanted to make sure that she fully understood
Yep.
the doctors were asking and what that meant for her recovery.
Having the support of the caregiver there is essential, is important no matter what the procedure is. So I want to kudos and thank you for stepping up. And I don't have to say that too. I know you probably would have done that anyway. But again, we hear a lot of those stories here at the patients program when we're talking to our patients, that not only were the doctors helpful, the nurses helpful, but having that support from the caregiver is essential. Ms. Margaret, have you ever been involved in research before?
No.
So never been involved in research before. So what did you hope to get out of participating in this research?
Well, and to let the doctors know that it's a personal decision regarding surgery.
So it seems like because you wanted to let doctors know that it was a personal decision to participate in research, Don, I want to talk to you a little bit more about that as the caregiver of your mom. Again, when you are one that kind of spells things out for her, make sure she's understanding what's exactly going on from the beginning to the end. What did you expect to get out of the research? And did you hope to participate in research where your needs met, I should say?
I think that my goal for us to participate within this is to make sure that my mom knew the importance of her voice, that she isn't just someone who comes through and has something happen to her. People make decisions, that it is really important to tell your healthcare team what's going on, the good, the bad, the in between, so that we can fix things. We can make changes. My mom was 96 when she fell and broke a hip. And there's not a lot of information out there about people over the age of 90 falling and breaking hips. And because she is able to speak, I really supported her joining this so that, healthcare providers could hear her voice and not just mine.
That's awesome. That's fantastic. I love that answer. Ms. Margaret, what were you asked to do in this research study? After the doctors explained it to you, then after your daughter kind of reaffirmed and made sure you understood what was being asked of you, what were you asked to do to participate in this research study?
Just to talk about my experiences.
Talking about her lived experiences throughout the process. Donna, you mentioned earlier about you wanted to make sure that she understood that. Do you think it was something, how can I say this? Like, was there a benefit from hearing it from directly from the patient and instead of the caregiver, I should say? What was the benefit for that?
Absolutely, because they heard in her voice. They weren't just listening to me, because I can become very clinical because of my experience, with my job. But this was her experience. And I know that for me as a nurse, it matters more what she says than what the caregivers say.
Gotcha. Now, you mentioned earlier that the hip fracture happened around the holidays. Did you think, this question is to both of you, but Don, I want you to answer this first. Did you think that during the holidays or busy time, you would be asked to participate in a research study when you had a hip fracture? Do you think it would just probably just be, okay, they're going to come in, they're going to treat me, we're going to recover, and that'd be it? Like, did you think you would participate in a research study?
Yeah. No, believe me, that was the last thing that I thought of in the midst of all that. We were just trying to make sure that my sister and I were taking turns and who's at the house and who's with the family. So it was not even a blip on my radar.
And Miss Margaret, how about you? When Donna asked you or talked to you about participating in a research study during your hip fracture procedure, what did you think about that? Did you think you would be asked to do to answer questions, to give your feedback in a research study?
Did you think that? No. No. All I wanted was to get well.
I bet that's kind of what we all want when we go in, whether it's a minor or major surgery. We just want to get well, get out of there, and be able to get back home and rest up and be on the road to recovery. Would you have been willing to have your hip fracture care chosen randomly by a computer, a flip of a coin, to decide which treatment that you would receive?
I just wanted the best.
I can side with you on that, Miss Margaret, because at the end of the day, when you're going through trauma like a surgery or something like that, you just want the best care possible. You just want the doctors and nurses to be on the same page. You want your caregiver to be on the same page. So at the end of the day, again, you can get back to the road to recovery as soon as possible. So flipping of a coin didn't necessarily matter, just a matter of you just wanted the best care. Donna, what about you? When you talk about the flip of a coin, were you and Miss Margaret aligned with the same, just wanting the best care, or did you mind a flip of a coin?
I wanted her to make the decision that would give her the best experience. So whatever she was comfortable with, that's what we wanted to happen for her.
Understandable. Dr. Slobogean and his team, I'm pretty sure they have always been in contact with you guys every step of the way, letting you know what was going on. My next question goes to, how could the medical team affect your decision to participate? And this includes everyone. We're talking about the nurses, the doctors, the therapists, and anybody else on the hospital staff. How could they affect your decision to participate in this research study?
I think making sure that there was what was really important, that the doctor and the team came in and the research team came in when it was a quiet environment. So we had a few minutes. We were able to talk. We were able to ask questions and understand the risk and benefits.
Understanding the risks and benefits are essential to making the decision, whether you're by yourself, but particularly when you're with a caregiver, someone. So the fact of the matter that Dr. Slobogean and his team made sure that was crucial, that made sure that was essential, and number one was, I'm pretty sure, help ease your decision not only to participate in this project. How about the environment in which you had these conversations? Does the environment in which you have these conversations, Miss Margaret, does that affect your decision to participate?
I think so. And gave you time to think, how bad off you are.
So quiet environment, one, that it was just us. So we weren't in the hustle and bustle of a semi-private room. You weren't hearing information from the patient next to you. You weren't hearing, doctors and nurses speak to someone else. It was that time when we could really reflect, and we knew that they were completely engaged with us and not concerned about the next patient they had to see or the one that they saw before.
Gotcha. Well, let's go back to the very beginning when Dr. Slobogean and your team and his team actually reached out to you to participate. What was the first thought when you were asked to join the research study? I'm going to go with you, Miss Margaret. What was the first thought that came to your mind when Dr. Slobogean and his team asked you to participate to join the research study?
Well, I felt it was necessary in a way. Because others would profit from what we were telling them.
You thought it was necessary because you figured that the information that you give to Dr. Slobogean and his team would benefit folks coming behind you.
Right.
I like that. I like that. Donna, were there key questions that you would have wanted Dr. Slobogean and his team to answer before deciding to participate as the caregiver? And then also I'll pitch that question to you, Ms. Margaret, as the person who was going through the surgery. Were there any questions that you wanted them to answer before you decided to participate?
For me, it was risks, obviously, and benefits of the two types of surgery. It was also had to do with her healing time, like how soon. She is not a patient person. She wants to do things, and she doesn't always want to follow what the healthcare providers or especially her daughters have to say. So which one is going to get her back to her baseline the soonest? They were the questions. And, pain management, like, is one going to be harder on her physically? Like, is she going to have more pain? Those were the questions that I really felt like were, need to be described and answered from the research perspective for caregivers.
Got you. Ms. Margaret, what about you? Were there any questions that you wanted answered before you participated in the study?
Well, how long would it take? The length of time.
How long would it take? How long are you guys going to be working on me? What questions you got to ask before I can get back to myself?
Right.
Or you can get back out there jogging around the neighborhood, but you can get back out there, exercising and doing what you need to do, right? I totally understand that, Miss Margaret. Totally understand that. Ms. Margaret, I actually got a question from Dr. Slobogean, and he shared with me that your hip fracture was fixed, but then it failed, and you had to have it replaced. If you were told that we think the replacement might be better, but it only offered to half of the patients participating in the research study, would this be compelling enough for you to join the study?
So, yes, I think so.
Oh.
Yeah. Because my life, I feel like as long as I've lived, if there's anything I have to offer, I certainly would appreciate it.
That's far too kind. That's far too kind. I really appreciate that, right? What about you, Donna? If that was presented to you, right? The hip fracture was fixed, then it failed, it had to be replaced. And Dr. Slobogean and his team, they told you that we think the replacement might be better, but it's only offered to half of the participants participating in the research study. Would that be compelling enough for you to join the study, for you to advise your mom to join the study?
That's why we did join the study, because she did have the hip fixed. It was repaired. She did have the pinning. And at the time we were like, okay, well, that's the least of the, two surgeries. That's the one that for her age that they really, felt like once you do some, research online, it's like, oh, having the pinning is a better outcome than having the hip replacement. Um, and then come to find out she really wanted the replacement from the go. So we were just like, well, the pinning is better for you. And then later on, she had a dehiscence and she had to have the hip replacement. And she's not acting sassy right now, but she did let us know, I told you so.
Miss Margaret, I'm only laughing because next week I actually have to go in for a minor surgery. I have to have my meniscus worked on. You can't tell right now, but I'm tall. I'm a 6'8" former basketball player, and I've never had anything happen to me during my career. But I am a huge Ravens fan, and I celebrated last December maybe a little bit too much. Got a little bit too excited and had something done to my knee. And I have an option to maybe just rehab right now, maybe, take a little bit of medicine, inflammatory medicine. And then if it gets better in another 3 months, then we can kind of go that route. Or they can go in right now and fix it. I want to be just like you, Miss Margaret. I want to get back to my baseline. I want to get right back out of there, go in there, fix it, and then I can do my rehab and get it done. So I understand why you are someone that thinks about, what are the options, what's best, and what's going to get me back to baseline.
Right.
Don, I have a couple of questions that's going to be steered to you as the caregiver, because again, this role when someone is recovering or going through and dealing with surgery is very important. And we always love to hear not only from the patient, but from the caregiver as well. What were some of your thoughts that you had about your mother joining the research study from the very beginning? Like, what went through your mind when this was first presented to you?
Are you guys ready for her? Was the first question. Thought. Number 2, she does not hold back. So she's going to answer the question. So I knew that she would be a good candidate for the research because she doesn't try and sugarcoat anything. She's going to let you know. If she wasn't happy about something, she made sure that she told us. She told her primary care physician about her surgeries. She did have a tumble after her first hip replacement, and she needed to have a second hip replacement. So and at that time, she was very adamant with the doctor. There is no pinning. There is going to be a second hip replacement, and it was only 6 weeks out from the first hip replacement and 8 weeks after a pinning. So she was not holding back. So that's what my thought was. Good luck to you guys, because she's going to come at you.
Mark, what do you do? I mean, you had hip surgery and you took a tumble and fall. You just can't sit still, huh?
Like the orthopedic surgeons, we think.
Like it. I love the energy. Donna, what do future patients need to know about being involved in research? I've been the community engagement specialist here for about 7 years with the patients program, and a lot of my role is out and about in the community trying to educate folks about the importance of research and having a seat at the table. What do future patients need to know about being involved in research that can help them better understand that their lived experiences is important in order for them to not only help their current situation, but like Miss Margaret mentioned before, folks that are coming behind them, people that are coming behind them need to have a little bit more information on how things are done when it comes to research.
I think that future patients need to understand that their voice is so important, because all patients talk,
Yep.
all families talk, and they share with one another their experiences. So if you had, especially if it's a negative experience, that gets shared.
Yeah.
But as a patient, I want to hear more about the good stuff. and the caregiver, I want to know what's the best route? What are the questions I need to ask before my mother falls and once my mother has fallen and broken her hip, who am I going to call to find out, what's the best options? So by them coming to the table, they present their story. They do shift the climate, the talk, all about what is in the best interest for our patients. Everybody wants to get back to their baseline. Everybody wants to use the least amount of medications because they have harmful effects. They also impact the healing process. All of those are really important to hear from the people who lived it, not just the ones who, see it in the hospital. Again, I take care of patients with hip fractures. Whole different ball game when it was my mom.
Yeah. I can imagine. I think we all would jump at the opportunity again to help someone in need. But when you're dealing with someone in need that's a family member, sometimes those emotions get in the way of it. But I know you fell back on your experience as a caregiver to kind of help guide you through that situation, and the experience you had, interactions you had with Dr. Slobogean and his team. I think from what I'm hearing, sound like it made it a little bit more smoother.
It did, but not everyone has that. So that's why, again, being part of a research group, that's when you really get to share it. And they listen.
Listening is so important in this work when it comes to research. And Dr. Slobogean and his team have worked with the patients program before on other projects, and they've heard from patients similar to Miss Margaret that the important thing is we want you guys to listen. We want you to hear me. We want you to hear us. Again, the good, the bad, the ugly, and indifferent. Miss Margaret, I want to ask this question to you. If you had a friend or a colleague or someone you knew that was a little bit hesitant to participate in a research study, what would you share with them from your experience with Dr. Slobogean and his team that would kind of give them the courage, give them the confidence to participate?
Yes, let them think that they can help others rather than just sit there and have pity parties.
Helping others and get out of the pity party. Nobody likes a pity party, so I totally get that. Totally understand that. We're almost out of here, and I got one more question for both of you guys. And again, I can't thank you enough for taking the time out to join us here on the bridge, having this conversation that hopefully, and I know will benefit others going forward. Let's talk about what do you want researchers to know, because that's why we're here. Dr. Slobogean and his team, not only do they do great work making sure that the patient is taken care of, the caregiver has the information that they need to make an educated decision. What do you want researchers to know about being a patient or a research participant? Because those are two different things. It seems like you guys walk both the lines. You were a patient first, and then they asked you to be a research participant. What are some things that the researchers should know before they ask you to do that?
I think they should listen and maybe get involved in with the patients and the doctor, with the research people, and encourage them to think more about getting better and have better results than just, going along. Most of them, just go along and think research, oh, that's not me. That's somebody.
Yeah.
They should get involved, I think.
They should have a seat at the table. They should let their voice be heard.
Listen.
And listen as well. What about you, Donna, from your perspective? Again, you're a caregiver, but again, also you're a nurse as well. So you wear many hats in this situation, this equation right there. So if you had an opportunity to talk to said researcher, what are some of the things that you would want them to know as a caregiver?
Be patient, answer the questions. Don't approach a patient and a family like they're in a rush.
Mm-hmm.
Slow down, take a breath, listen to them. I know that sometimes there's a whole big story people want to share. and make sure you have the caregiver there because the patient tends to feel a little more secure. The caregiver gets their questions answered. Please don't rush it and have that quiet space. And I know that it's not always an easy thing to do, but when you look at someone, look in the eye versus looking down and checking off boxes, that's a huge difference for caregivers and their patients.
Donna, we've heard that before in different projects from different patients who've been in a patient room and the doctor comes in and immediately asks questions that either, like you just mentioned, they're looking down at their paper or they're on the computer putting in information. And we understand that, they may be in between clients, things of that nature, but it's important to take the time out to do those things. And I'm not even going to say small things. Do those things that are important. Do the things that you would want done to you. You will want somebody to look you in your eye. You will want somebody to take their time to make sure you understand the questions. You will want somebody to make sure they speak clearly. And then whenever that session is over, you want to make sure they have all their questions asked. And it seems like Dr. Slobogean and his team have done that for you. Again, I totally appreciate the time that we've taken out today to have this conversation because, Miss Margaret, your participation in this project not only helped and benefited you to get back to your baseline, to have you back active as you would like to be at your 92 years age.
98 now.
You lying to me.
No, she'll be 99 in June.
99 in June, Miss Margaret, and you're still rocking and rolling. I love it. I loved it.
Girls' weekend. She came back from a girls' weekend. We can't talk about that.
Okay, that's a whole nother podcast, a whole nother show. But what we do know is, Miss Margaret, you're sitting at the table, you're having your voice being heard during this project has been helpful to Dr. Slobogean and his team in HIPATAC, but also the future patients, the future clients, and more importantly, future researchers. Because this is a whole process where everyone is involved, the patient, the caregiver, the researcher. And I can't give enough finger snaps to you for showing up today, but then also to Dr. Slobogean and his team for taking the time out to join us on the bridge to have this conversation. Because as we all know, again, it's not just the doctor and it's not just the patient. It's everyone involved. Ms. Margaret, Donna, thank you again for participating. I truly appreciate it. And thank you for joining us on the bridge.
Thank you.
And good luck to the research.
Thank you for listening to The Bridge. Your health, your voice. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.